Hi, today we're going to talk about diabetes in dogs and cats. Diabetes is when there's not enough insulin in the body, and what happens is that the sugar goes up in the blood, and that causes all sorts of health problems. You might see increased drinking and increased urinating in your dog or cat. They also sometimes are weak and have other medical problems that can be serious. But luckily, the use of insulin will lower the blood sugar and really help your dog or cat live a full, complete life with minimal health problems. So when you have insulin, when you have diabetes, you have to give insulin. And you'd get a bottle of insulin from a drugstore, and the first thing you do when you keep it in the refrigerator is you take it out, is you have to mix it. And when you mix insulin, you shouldn't shake it. You should just sort of roll it in your hands very gently. And then that'll suspend the insulin in the solution. Then you have to take a syringe, and the little tiny needles that you give, that are on these syringes, and you put the syringe in the bottle, and then once it's in the bottle, you pull out on the plunger to the amount of insulin that you need. And actually on the syringes, there's little marks that tell you how many units, and each mark is a unit. And typically you give between 2 and 20 units per pet, and of course we'll tell you how much to give and how to adjust it every day. So you pull the insulin out of the syringe, and then you go to the patient, and it's always a good idea to have the dog or cat on a table, or at least somewhat stabilized. I like tables because they can't run away, and it's always good to have the patient comfortable. So I take a little bit of alcohol on the skin, and I lift the skin, I make a little tent out of it, and then I take the syringe and I put the needle on the bottom of the tent, so that way it doesn't go out through the top. And we're not going to actually give it to Monty because he's already had his insulin today, but once you put it in, you pull back on the plunger to make sure that there's no blood. If there's no blood, just give the injection and you're done. If there is blood, just pull out the syringe and start again. And it's really rare to get blood in the syringe. I probably give over 10,000 injections a year, and I almost never get any blood back. But it's just something to watch. And you should be giving the insulin twice a day, and we'll explain how to monitor it. But at home, we want you to get urine every 3 days, every time your pet urinates, and we want you to use something called keto diastics. Keto diastics measures the amount of sugar in the urine, and it comes in a little strip, and it measures two things. One is called ketones, and ketones are just a product of the blood that increases when diabetes isn't well controlled. So you're going to dip the stick in the urine, and in 15 seconds you look at this chart on the bottle, and the ketones should always be negative or a trace, and if it's ever above that, just give us a call. In 30 seconds you read the actual glucose, which is sugar, and normally glucose is supposed to be negative. Ideally in diabetes, we like to keep the range at around a trace to 1/4%, or close to negative. And then if it ever goes up to 2+ or 1+, you have to increase the insulin. We'll help you with that. But the main part today is I want you to be comfortable giving the injections. It's not that difficult. And also to monitor with the keto diastics. And always feel free to call us if you have any questions.